I've heard from many of you that you wanted a session on the mental health aspect of cancer. Our second presenter, Dr. Michael LaSala, knows this topic well, personally and professionally. Dr. LaSala is a professor at Rutgers University and has practiced psychotherapy for 35 years with a particular focus on the LGBTQ community. Dr. LaSala is also an anal cancer thriver and well-loved mentor in the Anal Cancer Foundation's peer-to-peer support program. Dr. LaSala will focus on the S in R.E.S.E.T, support from peers and professionals, and address the importance of seeking mental health support and self-advocacy. Following his presentation, we will have an opportunity to ask Dr. LaSala our questions live. We are so thankful that he is sharing his time with us today and for his commitment to our community. Now I'm going to turn it over to Dr. LaSala.
Hello, folks. My name is Dr. Michael LaSala. I'm a professor at Rutgers University. I am a licensed clinical social worker and licensed mental health professional, and I am honored to be asked to speak with you about how to emotionally cope with the anal cancer experience. What I'm going to present to you is a combination of things I found personally useful in my own journey, as well as what the research says about coping with cancer. And I hope you find it helpful. Here's my family. To my right is my husband of 41 years. Actually, we're married 9 years, but together 41. And there's our dog, Tasty, and that's my family. Okay, so when we're first diagnosed and also as we proceed with the anal cancer journey, right? Lots of feelings come up and issues. So things like fear, what's going to happen next, uncertainty. We become face to face with our own mortality. We know that life is finite, and nothing reminds us of this more than an anal cancer or a cancer diagnosis. Things can feel out of control, and we can feel also very isolated. As we all know, anal cancer is relatively rare, so we may not have people in our social networks who have experienced this, and so we may feel like we have nobody really to talk to about this who will understand. Getting anal cancer and cancer in and of itself really is a crash course in how unpredictable life is and how there's no guarantees. We might even have a spiritual crisis around, those of us who are spiritually inclined. Where is God? Have I been abandoned? And also, as illustrated by this young lady's look on her face, we can experience a lot of strange reactions from people, particularly when they find out we have cancer or upon the moment we self-disclose about it. We don't have time here to discuss that, but it's always a good idea to get together with other cancer survivors and share and laugh over how other people respond to hearing about our diagnosis. Now let's get to the meat of the matter, which is about the coping. I may not be a full expert personally on coping. There have certainly been times that I've had to white knuckle it or I was hanging by a thread. But here are some techniques that I have used that I have found helpful, and also that I have found in the academic literature regarding how people cope with cancer. Number one is acceptance. We have to really, if we want to really cope with cancer, we have to accept our diagnosis and not deny it and just try to embrace it in some ways. Really, really important to be kind to yourself as you're going through this experience. I remember once I was waiting I was in a waiting room waiting to go for scans. And we all know how scary those scans can be. And a friend of mine texted me and said, when you go into the scan, go in with a heart full of love for yourself. And I held that with me throughout the experience, and I still try to hold that with me as I proceed with surviving and thriving. It's important to get emotional support. Like I said before, we're pretty isolated because of the rarity of this illness. So one way to do that, you're all doing it by attending this conference, right? Another way is through joining the mentor program. I myself have been a mentor, and I find that it's very helpful either to mentor or to be mentored, and it helps you feel less isolated. There is some literature and some research that suggests if you can find something positive about the experience, this will benefit you emotionally and psychologically. There's also some evidence that it may benefit you physically as well. What is the positive, what if anything is positive that you can take away from this experience? Perhaps some more clarity about where you want to go in life, what your goals are, etc. It's important not to be too passive and to take action when you can. A lot of this is unpredictable, but if you can figure out what are the steps what are things you have control over and what are steps that you can take, that also will be enormously helpful in your coping. If you're religiously or spiritually inclined, this is a time to really dig in deep and, do more in those areas, more prayers, more working on building your faith. In addition, mindfulness, very big trend in psychology, and mindfulness really is about living in the present, not worrying about the future, which is very easy to do with a cancer diagnosis, but living in the present, trying to enjoy and wrest as much pleasure from the current moment as you can, and let tomorrow worry about itself. Humor. I don't know about you, but I couldn't get through this experience without humor. As a matter of fact, it started right from the start. I would go into my radiation sessions and ask the technicians if I could bring in a tray of frozen lasagna, and if they could zap that for me, it would just make my dinner time so much easier. And that's just one example. I think it's really important to continue to use humor throughout the experience. And very important, think back about traumatic incidences that you have been through, and what were the coping mechanisms you used during those times? Perhaps you went through a divorce, death of a loved one, etc. How did you get through a heartbreak? How did you get through those experiences? And see what you can do to reprise those coping mechanisms. Okay, now, I am a gay man from New Jersey, and I need to keep it real for you all and remind you that there are some days where none of those coping mechanisms work, where we can't access our resilience and our strength. And on those days, the best we can do is just put one foot in front of the other and get through the day. In the words of Winston Churchill, when walking through hell, just keep walking. Sometimes that's just the best we can do, and that's okay. Just get through it. Here are some signs that perhaps you need to reach out for more professional help from a licensed mental health professional, social worker, psychologist, psychiatrist. If you have ongoing sleep issues that emerge during the diagnosis or thriving period, ongoing eating issues, changes in your appetite, if your feelings of fear, sadness, anxiety, depression, all of which are normal, but if they rise to the extent of interfering with your daily life over a long period of time, interfering with your ability to work, be in relationships, to function day to day, that's a time to reach out for professional help. And of course, if you're getting thoughts of wanting to end your own life or wanting to hurt yourself. What I have presented thus far has been mostly from the academic and research literature, which fortunately I have access to as a professor at a university. However, that doesn't answer all of the questions about coping, and I'm willing to bet that many of us have creative coping techniques that we have used through this experience that other people could benefit from if they were shared. For example, something not in the literature, but something that I did that I found very helpful is once I was diagnosed, I started to make a list of all of the people I knew who had survived cancer, whether that be celebrities, people in my family, friends, colleagues, etc. And I came up with a really big list, and I found that that was really helpful. So during the Q&A, I really look forward to hearing from you folks. I want to know what your questions are. But also I want to know, what have you done that you have found was successful in coping with the anal cancer experience? And I look forward to speaking with you soon about that.